Kids across the country continue to return to school after the holiday break despite these new surges of COVID-19.
Yeah, get this, 65,000 students in Los Angeles tested positive for in-person learning. Even though it's going on as planned, still going back to class. But in Boston, so many staff members were out. The superintendent filled in as a substitute teacher. Let's bring in now that substitute teacher, also known as the superintendent of Boston Public Schools, Dr. Brenda Cassellius. Dr. Cassellius, thank you for being here. Look, I think you all were out yesterday, mostly because of cold temperatures, but some staff shortages. But on Monday, the numbers were 1,200 staff out, 73% daily student attendance, and then 1,100 students and staff tested positive. That was last week. So give us the update about today. How are you on your staff and student numbers as you go back to class?
The numbers look about the same, Amy and TJ, and thank you for having me on this afternoon. We have an all hands on deck here, and our central office team, our amazing teachers, our amazing educators working across our entire city to really rally for our kids.
You know, every district across this country is handling this differently. I know my daughter here in New York City just went back to in-person today after testing. Yeah. What is the threshold for you there in the Boston area to decide whether or not to keep schools in person, to go back to remote? How do you make that call?
Well, we are looking as a team at 3 different measures. We're looking at the health and safety measures with our Boston Public Health Commission. We're looking at our operational challenges that we might have at any school. And then we are looking at our staffing, of course. And we meet 3 times a day to look at those numbers and to assess school by school, classroom by classroom. And every now and then, whether you have specific classroom with students with autism, for instance, or you have other health measures going on with transmission in school, that's when we decide whether we will close a classroom or close a school.
Dr. Cassellius, how do you all handle testing there with your students and staff? And do you have, look, everybody in the country seems to be clamoring for these tests these days. Do you have what you need?
Well, I'm thankful to the Biden administration today announcing that they'll be able to provide more testing out to our school superintendents across the nation. This is one piece of mitigation. Of course, we've been doing masking, we've been doing vaccines and air quality throughout the district to make sure that we have the right public health measures in our schools to keep our staff and our students safe. We in Boston need more testing as well. This is one very big piece of keeping COVID out of our classrooms so that we can keep in-person learning going.
Dr. Cassellius, we talk about obviously the physical concerns of getting sick from COVID-19, but there are so many mental issues here, so much anxiety among parents, students, teachers, trying to do what's right for the students and at the same time staying safe. What is your advice to those groups dealing with some of the mental stresses of what we're dealing with here as a country collectively, but individually on it from a family-to-family basis, deciding whether or not to put their kids back in the classroom?
Well, first I want to thank our families. They have just been on the front lines. We always have said that a parent is our student's first teacher, and that has been more true these past 2 years. So I want to thank our families and then our amazing educators who go into their classrooms every single day, give 100%. Our central office teams who have been covering now over the past several weeks to ensure that we have all of our classrooms with a caring and competent adult in each one of them. The mental health issues are both real for our staff and our students because this is going on for 2 years. Our students have experienced a lot of isolation. We in Boston have been fortunate that last year our city gave us the funding to be able to have family liaisons for our families who are in crisis and also social workers in every single school. This has really helped us to provide supports to our students. I'm so thankful to our mayor for giving us these resources in order to ensure that our students get what they need.
Dr. Cassellius, you teaching any more classes this week?
I did. I taught a 7th grade class this week, and last week I was swabbing noses to make sure that our students are safe, wherever we have to pitch in. But of course, I just am one person of hundreds across our entire district who have stepped up for our kids.
Well, Dr. Brenda Cassellius, superintendent, sometimes nose swabber, sometimes substitute teacher of Boston Public Schools. Thank you very much. We appreciate all you're doing, and thank you for being on the program today.
Oh, thank you, Amy and TJ, and you have a wonderful day.
All right, and look, we are the kids of educators. Yep. We know you're not just a teacher. No. You're everything sometimes to these kids, including a nose swabber.
Who knew that was going to be in the job description?
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here. to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.